Hello, welcome to the Presumptive Eligibility Training for Pregnant Women. This is the training to know how to do presumptive eligibility for pregnant women. So if you are a new employee, this will be your first training that you're going to come through in order to get all of the policies and procedures that you would need to do in order to do a PE terminations correctly and according to DCH policies and procedures. If you are a veteran employee reviewing this training, of course, this training is not new to you. It's just going to be a refresher for you to brush up on any policy or procedures that you would need to do. This training is a recorded training with no audience. So in order to ask questions that you have while you're going through this training, there will be a document provided to you where you can jot down all of the questions that you have when you are going through this presentation. Once you send back the questions, you will be provided a response to those questions. But like I said, this is a recorded training with no audience, so you will have to jot down your questions that you have and send them over to DCH for responses. So like I said, this is the presumptive eligibility training for pregnant women. We're going to go over all of the policies and procedures that you would need to know in order to do this program correctly. So my name is Kanita Sneed, and I am the trainer for this program and also the contact person for the presumptive eligibility program. So we're going to go ahead and get started. Of course, our mission at the Department of Community Health, we're trying to make sure that we provide access to affordable quality health care to Georgians through effective planning, purchasing, and oversight. The purpose at Department of Community Health, we're shaping the future of a healthy Georgia by improving access and ensuring qualities to strengthen the communities that we serve. Again, this is the training on all of the policies and procedures for the presumptive eligibility program for pregnant women. So, what are the objectives for each participant reviewing this training? So you're going to understand what the definition and description of presumptive eligibility is, and most of the times you're going to hear me say PE. If you hear me say PE, just know that that stands for presumptive eligibility. You're going to understand what PE covers, understand the responsibility as a qualified provider participating in this program. We're going to look at the requirements of this program. What are we going to look at, or what determines if someone is eligible for this program? So we're going to look at the program requirements as well as the eligibility requirements. Understand the PE procedures and manual updates. With this program, there are some procedures that we're going to go through based off of what information you get from the member. We're going to look at what procedures that you would actually need to follow. And then we're also going to look at manual updates. So if you're not able to enter something into the system or something is incorrect and it needs to be updated, there is a manual process for that. We're going to look at some screenshots of how to enter this information to GAMIS, because you're going to be doing forms. So once you do all of your forms and make the determination on paper, then you're going to have to add that approval person into GAMIS. So we're going to look at how to do that. And then we're going to also look at what references you can use. So to start us off, we're going to talk about the definition and the description of presumptive eligibility. So presumptive eligibility, this is just an expedited process of how we enroll eligible people into the Medicaid program. So for pregnant women, if they are pregnant and they need to get on Medicaid, right away, then this is the process that they would need to apply for. So you as a qualified provider, that is what you're going to be determining, a presumptive eligibility determination for pregnant women. So what are we going to look at? What is their eligibility going to be based on? It's going to be based on their household income, which is modified adjusted gross income, which is MAGI, and that correlates to tax filer status. So now they're going to have a tax filer relationship. The household size, because that determines the budget group. Of course, they have to be a U.S. citizen or a qualified immigrant, and they have to be a resident of Georgia. So, medical assistance coverage may be granted to pregnant women applicants, and their income cannot exceed 220% of the federal poverty level. And we're going to have an income limit chart that you're going to compare their income to make sure that they are meeting the income requirements. Now we're going to talk about the PE period. What is a PE period? The PE period begins on the day that they come in and apply with you and get approved, and it ends the next month at the end of the month. So I gave you some examples to go through. So one example is if I have a person who applied on January 26, 2021, what would be their PE period time? So the PE period time would be from 1/26/2021 through February 28, 2021, because February is the next month, and we always end it at that last day of that month. So it's February 28, 2021. Another example is an individual applies on February 1st. What is the PE period? The PE period will be from February 1st, 2021 through March 31st, 2021. So when you inform your customer of their PE period time, this is the information that you would give them. Also in the background, but this is like really for your information that you really don't provide to the client, is that PE period may end before the end of that following month, because if DFACS has 10 days to process the application. So once you send the application off to DFACS to process for the full determination, if DFACS processes that case like the next day or the same day or 2 days later, then that full determination is going to trump the PE determination. So that means the PE is going to end and the full Medicaid is going to pick up. But that's kind of like in the background of it, but you would just need to know what is the PE period time is from the application date to the end of the next month, the following month. Now we're going to talk about what does the presumptive eligibility cover. So for presumptive eligibility for pregnant women, it only covers their prenatal care visits and their pharmacy services. So that's the only thing it's really going to cover. So it really gives them some type of coverage while their full determination is being processed. So that's really the intent of this program, is to give them some type of Medicaid coverage while their full determination is being made by DFACS. So it does not cover for labor and delivery or if they get admitted to the hospital. So it only pays for their prenatal care and pharmacy services. And once they have been approved, they are able to go and get their prenatal care services. So they're able to go that same day. But for pharmacy services, you would need to know that it takes at least 24 to 48 hours before they're able to go and get any prescriptions filled. And so once the member or once the applicant has been approved, please let them know up front that it's going to take at least 24 to 48 hours before they're able to go get any prescriptions filled. Once you tell them that information, if they come back to you and say, hey, it's really an emergency, I really need my prescriptions filled today, can you make something happen? I really need my prescriptions. So in those situations, what you can do is to send an email to the PE corrections box, and the email address is listed on the slide. You will send the member's first and last name and their ID number. In the subject line, you can just put update pharmacy or pharmacy request, whatever you want to do. Just let us know that we need to update this request. So those are only in emergency situation. Otherwise, they would need to wait at least 24 to 48 hours before they go to get any prescriptions filled. The next coverage is dental coverage. Pregnant women are allowed certain dental coverages, certain dental services. So in order for them to get the dental services, they will have to attest that they are pregnant, but they're going to have to get this information completed by their doctor. So I'm going to go to the next slide. And this is the DMA 635 form called attestation of pregnancy. So if a person, a pregnant woman tells you that, they're trying to go see their doctor, then you need to make sure you give them a copy of this form, and they will take this form to their doctor to have their doctor complete it out. Once their doctor completed and give it back to them, then they can take that completed form to their dentist to verify their pregnancy, and they'll be able to get the dental services that they need. So again, if they need dental services, please make sure you're giving them a copy of this form, the DMA 635. Okay, if you have someone that comes in your facility and they are incarcerated, these individuals are not eligible for presumptive eligibility. So you would not complete a PE application on them. You will let them know that they're not eligible at this moment, but once they have been released, they can come and apply for presumptive once they have been released. So if they're still incarcerated, please do not complete a PE application on these group of individuals. So now we're going to look at the responsibilities for the qualified provider. So as a qualified provider participating in this program, these are the responsibilities that you need to make sure that you are here to. First, you need to make sure that you are making correct PE determination. That means you're following the policies and the procedures that you're going to be given in this training. Also, if you determine that someone has been eligible for this program, then remember at the beginning I told you you're going to be doing everything on paper first. And once you make that determination, if they have been approved, then you're going to put them into GAMIS. And the reason why you're putting them into GAMIS, that's because that's how their claims for their medical services and prescriptions get paid. Because without that information into GAMIS, that tells GAMIS that they don't have any coverage if you don't put anything in there. Because GAMIS does not make the eligibility determination. You all make the determination, and you're just putting that approval into GAMIS. So those claims that come through for that customer, they can get paid based off of that information that is in GAMIS. You're going to forward your PE, inform the applicant in writing of the PE determination. So you're going to tell them verbally and in a written form. We'll have a form for it. And also there is a certificate that you will be able to print out for the ones that are approved. So also you're going to make sure that you send the information that you need to send to DFACS for processing of the full application. So we're going to talk a little later on in the training about the PE packet. That's what we call it. You send a PE packet to DFACS, and we're going to let you know what should be included in that packet. And you need to send these PE packets to DFACS within 5 business days. You have at least 5 business days from the date of the application to send it to DFACS. But I want you all to get in the habit of trying to send these applications daily, because you may never know when you may be out of the office. And if you're out of the office, you may be out of the office for a certain period of time. So if you're out of the office and let's say the day before you went out, you did an application, but you didn't send it to DFACS. Well, that application that's sitting there on your desk and it's not being an eligibility determination for full Medicaid is not being determined because it's sitting there on your desk. So that's why I say if you can, try to get in the habit of sending these on a daily basis. And when you're sending these packets, I highly recommend that you kind of keep a record of these. I don't know how long you all keep your PE packet. That just depends on your particular facility or either your policy for retention for your particular agency. So I know for us at the Department of Community Health, we have to retain records for at least 3 years. Then after that, we can get rid of them. So, but I highly recommend you keep that. And that's because a lot of times I may have to reach out to you, or a member may come back to you and say that their Medicaid has ended and they don't have any coverage anymore. Well, when we go through the training, you're going to see one of the procedures is if that situation happens, there's a procedure that you would need to follow. And one of it is that you would need to locate the PE application if they completed it in your office and send it to me. So that's why I say keep a record of your PE packet. Summarize any benefits and answer any questions that your applicant has once they have been approved. And then there's some information that you need to provide them. a quick guide on the presumptive eligibility of pregnant women, and you'll look at a form. We'll look at what that looks like. Also, there are booklets that you can order to provide to your member if they need to understand more about medical assistance in the state of Georgia. Also, we have a notice of ADA Section 504 rights. It's just information for the applicant, and it's just talking about people with, an ADA disability. And then also we're going to be looking at some Planning for Healthy Babies information that you can provide to your applicant. I highly recommend that you utilize your PE manual. There's a policy manual that is located on the GAMIS web portal. It is updated every quarter, so I highly recommend that you use that. You use any training materials that you have been provided. You can also reach out to your PE coordinators or any other colleague that is making PE determination. We just want to make sure that you keep your knowledge up to date. And also after this training, if there's any kind of updates to policy or any clarification to policy that I need to get out to you all, those will be sent out via email. So I'm gonna need to make sure that you all check your emails, because you may never know when DCH needs to send you something out in regards to this program. But if something needs to be communicated out to you all about this program, it will be sent via email. If you have any questions or anything in regards to this program, please make sure you're reaching out to your PE coordinator or either myself. Don't reach out to DFACS about this process. So now we're going to get into the program requirements for this program. So the first thing is, how often can someone apply for presumptive eligibility? And the answer is, for a pregnant woman, she can apply every time she is pregnant with a new pregnancy. Can't be the same pregnancy. It can't be that, she applied for presumptive, got approved, and for some reason, now she doesn't have any coverage, and then she's trying to come back to you saying that she doesn't have any coverage, and you're trying to do another PE application on her. No, it's still the same pregnancy. Nothing happened to that pregnancy. It's just her coverage had ended. So in that situation, that's when you will follow a particular procedure that we're going to go through in just a moment. But it has to be a new pregnancy in order for her to do another PE application. So each time the woman is pregnant with a new pregnancy, she can apply for presumptive eligibility. So now we're going to get into the scope of the program, what you need to do, the steps you need to take. So the first thing you would need to do before you take a PE application is, we always screen all of our applicants in GAMIS to see if they're already active on Medicaid or not, and to also get their known ID number that is in the system if they had Medicaid in Georgia before. So that is the first step you should always do, is to screen your members' eligibility to determine if they have any eligibility or not. And based off of that, that will let you know what procedure you will need to take, whether you are able to do a PE application on that individual or not. So let's start with screening. So if you screen a person in GAMIS, if it shows that they're active on full Medicaid, and so I'm going to skip to a couple of slides down, and then we'll come back to slide 12. So we're going to skip to slide 14. So if you screen someone into GAMIS and it shows that they're active, if it shows they're active, it's also going to show you what aid category they're active up under. So if they're active up under one of these aid categories that is listed in this chart, that means you do not complete a PE application on them. They already have Medicaid, so there's no need to do a PE application on them. So you would just let them know you're already active on Medicaid. So if you need to report your pregnancy now, then you need to go to DFACS and report it. And they can go online to Gateway or either call the 1877 number to report their pregnancy information. So if you screen them and they're on full Medicaid, which is going to be one of these aid categories that is listed, then that means you do not do a PE application on them. You just refer them to DFACS if they need to report their pregnancy. And we're going to talk about the ones highlighted in yellow, or the turquoise green color. If you screen someone and it shows that they're active on Planning for Healthy Babies, which is P4HB, and you're looking at the aid categories 180 or 181, then this is the steps that you need to take. So again, if they're show active on Planning for Healthy Babies 180 or 181, these are the steps that you need to take. You're really basically going to treat them as if they don't have Medicaid. So you're going to complete a PE application on them and make a determination to see if they're going to be eligible or not. If they are eligible, then you're going to add the PE to GAMIS. And then once you do that, you're going to also complete a PE manual update form. And we're going to talk about this process in just a moment. But there is a PE manual update form you're going to complete and send that to DCH along with a copy of your 632. And that form is being completed because you're telling DCH, hey, this lady needs to have her P4HB case terminated. So that's why you're completing this form. So again, if it's P4HB 180 or 181, complete the PE process. If they are eligible, add it to GAMIS. And then you're going to complete a PE manual update form and send it along with the 632, which is your PE application. Send it to DCH, and we will terminate that P4HB case. And you're sending it to the email address that we seen earlier, the PE corrections email address. That's where you're going to be sending all of your PE manual updates to. But we'll talk about this process in just a moment. So for other people that are active on Medicaid, these are the steps that you would need to do. Remember, I told you that chart that's on slide 14. So if they're listed on their chart in slide 14 and they need to report their pregnancy, they need to report it directly to DFACS, go online on Gateway and report it as a change, or either they can call the 1877 number that is listed. If it shows that the member is active on women's health, which is going to be a category 245, then you need to make sure you let the member know that pregnancy needs to be reported to DFACS to the caseworker. So again, they can go online to Gateway. They can also call this 1877 number. And if a caseworker is attached to their case, then it will transfer them to their particular caseworker. If you want to, you all can send an email to the Women's Health email address that's listed here to let them know about this woman that is active on Women's Health that is now pregnant. So those are the options to let DFACS know that this actual person is pregnant. If a member is active on SSI, then you're going to have to fill out an SSI Pregnant Women Update form and email that form also to the same email address, pcorrections@dch.ga.gov. If you go to slide 15, this is what the form looks like. So what you're going to do is to fill out the top information about the member, their name, their ID number, which is the ID number from GAMIS, their social security number, the number of weeks that they're pregnant, what is their expected delivery date, and how many they are expecting. And then you're going to print your information at the bottom with your name, your agency name, your direct phone number, and the date that you emailed this. I know it says date emailed or fax, but you can only email, so the date that you emailed it. So once you complete that, you're sending it to this email address that's listed on the form. You're sending it directly to that email address. And what we would do is we would go into the system, add this pregnancy information into GAMIS. That's all we're going to do is add this pregnancy information into GAMIS. So don't tell the member that the SSI Medicaid is going to be terminated and she's going to be switched to pregnancy Medicaid. That's not the case. We're going to only put the pregnancy information into the system. So therefore, when the claims come in related to her pregnancy, they will be covered because her pregnancy information is in the system. Okay, now we're going to go over all of the forms that you're going to need for this process. So there are several forms that we're going to be looking at them each individually. And here's a list of the form names and the form numbers and the last revision date. And make sure to put the revision date because you need to make sure that you're using the most recent version because sometimes these forms do get updated And so if they do get updated, of course, you will be sent the email to let you know that it has been updated, and I will attach a copy of that updated form with the email. And then you need to, after that, make sure you continue to use that most recent one. So please familiarize yourself with the form number, with the form name, because a lot of times, especially if you have to talk to me, I can say either or. I can give you the form number or I can give you the form name. So if I do that, you need to know exactly what form I'm talking about, either by the name or by the number. So the first form we're going to be looking at is your PE application. So your PE application, this is the form that you use for every individual that is applying for presumptive eligibility. So if they come in, want to apply for presumptive eligibility, you always use this form. So this form is the presumptive eligibility form, your PE application, and it's the 632. If you go down, if you go down all the way down to the bottom, right down here, I know it's hard to see, but if you go down to the bottom, it would give you the form number along with the revision date in parentheses, so you know you have the most recent version. So again, this is the 632, the PE application. The PE application comes in, has 2 pages with it, but most of the times you're only going to be using page 1. If you have to use page 2, the only reason you would use page 2 is if there are like 6 or 7, more than 4 people in that particular budget group that needs to be listed on the application. If it's like more than 4 people, then that means on page 1, no, more than 5, I'm sorry, it's 5 lines. So 1, 2, 3, 4, 5. So if there's more than 5 people in this budget group that needs to be listed on this application, what you're going to do is list the first 5 people on the page 1, and then you're going to come over here and list the remaining people on this page. You don't duplicate the same information that you had on page 1 on page 2. On page 2 is only the remaining people that you need to add on this application. This form, or really most of the forms, are in PDF file, which are fillable, which means that you can type on them if you don't want to handwrite on them. And I highly recommend that you type this information out, because that would be more clear. But if you have to write this out, or if you have to handwrite this out, please make sure that you are writing clearly. Because I know sometimes we get in a hurry and sometimes our handwriting is not the best. So if you do have to handwrite this information, please make sure that you are writing clearly. Okay, our next form we're going to talk about is our notice of action. And there's 2 forms to this. It's either going to be the approval or it's going to be the denial. So remember, I was telling you earlier, when someone has been approved or denied, we have to let them know verbally, and we also have to let them know in written form. So this is the written form that you would give to them to let them know if they have been approved or denied. So this is your notice of action, your 634. On your left-hand side right here, this is the approval form. So you're going to fill in the member's information here at the top with their ID number, and then you're going to put your information down here at the bottom. And this is the approval one. If it's denied, the member's information is going to go up here at the top. And then here, I know you really, right here, the drop-down box, you're going to have to choose the reason why someone was denied. And we're going to go over those reasons why someone can be denied later on in the presentation. And then you are going to complete your information down here at the bottom. So again, this is your 634 notice of action, either your approval or denial. Okay. Your next form is the Hipaa. Of course, we all know what this is, the Notice of Privacy Practice. This is the Hipaa form 5460. So when we get into the procedures, you will notice that with the Hipaa form, this is just letting them know about, how we keep their information confidential and all of that. So when they're going to be like 2 ways that you can do these PE applications, and we're going to talk about that later on. You're either going to be doing it while the member is in the office with you, or you can choose the option to do them over the phone, which means a member can call in and apply for presumptive eligibility with you, and you take the application via the phone. And we're going to talk about those two different processes. So if they're doing it in the office with you, the member is there with you, then of course you're going to get them to sign this last page of the 5460. And this is just indicating that they received this form. So you're going to have them sign it, print their name and date it, and you're going to keep this last page, and all the rest of these pages that come before the signature page, you're going to make sure you need to give that to your applicant. But if you're going to be doing this over the telephone, then the member is not there in the office with you. So you're going to be sending all pages to your applicant. So they don't have to sign anything and send it back to you. You just send them all pages of this if you're doing it over the phone. Okay. Our next one is the full Medicaid application. We usually call this a single streamline medical assistance application. So when they are applying for presumptive eligibility, they're also required to apply for full Medicaid. And in order to apply for full Medicaid, they're going to be completing this form right here, which is the 94A. So this is just the cover page for the 94A because it's like 8 pages long. So this is just the cover page right here, the one that is in orange, the first one. So if they are applying for presumptive eligibility, you're also going to have to give them this form so they can complete it and apply for full Medicaid. And then also remember, I was telling you with the applications that are being done over the phone, and the member won't be completing this. You're going to have to be completing this because they're not in the office with you, but we're going to talk about that later on. With this form, there are 3 associated attachments that go along with this form, but these 3 attachments are only to be completed if it is applicable to the member. So if it's not applicable to the applicant, then they don't have to complete it. But if it is applicable to them, it needs to be completed. So the first attachment is attachment A. And they will complete this form if they have other health insurance and it comes through a job. So if I'm a pregnant woman coming in to apply for presumptive eligibility, and you could just take my job here, for instance, I'm working for the Department of Community Health. Of course, I have health insurance, through my job already. So if I'm applying for Medicaid, then I will fill this attachment A out right here because I have other health insurance and it's through a job. Attachment B, if they are an American Indian or Alaska Native, they need to complete attachment B. Attachment C, if they want to have someone as their authorized representative, or if they have a power of attorney, or they want to assign someone as their authorized representative, to apply on their behalf, to speak on their behalf, to get their notices and everything of that nature, then that person would need to complete attachment C. And then if there's anybody else also assisting them with filling out this application, that person would need to fill out the bottom of attachment C. So again, this is the full Medicaid application, the 94A. Then it has the 3 attachments associated with it. The next form is your DMA 285. And this is your third-party liability form. So if someone has other health insurance, whether it's through a job or not, they need to complete this attachment right here. And then also, if they have available a copy of their insurance card, then you would need to make a copy of that, the front and back side, and send it along with the DMA 285. But this is the DMA 285 third-party liability. So they need to complete this form out if they have other health insurance, whether it's through a job or not. So they can have health insurance and they're just paying for it on their own. They would complete this attachment. If they have other health insurance and it's through a job, they're going to complete this along with attachment A. Your next one is the Notice of ADA Section 504 rights. This is just information only, but what you're going to do is just put a copy of this in your PE packet that you're going to send to DFACS, and then you're going to give a copy to your applicant. And remember, the revised date of this one was last updated on 12/9/2020, so you need to make sure you're using the most recent version. So again, a copy goes in your PE packet that you send to DFACS, and then a copy should be given to your applicant. Okay, I was telling you about applications that you can do over the phone. So, you know, during the COVID pandemic, we decided to come up with a procedure that will help keep you all safe, as well help keep individuals safe that are applying for this program. So we came up with this telephonic signature process. And what it is that you can take PE applications over the phone. So the first page of this attachment A is just information to let you know, that we came up with this procedure, and then it gives you the steps of what you need to do. So if you're doing applications over the phone, I highly recommend that you keep a copy of this with you, because it gives you the step-by-step process that you need to do. It tells you do the interview and complete all your necessary forms. Inform the applicant that they will also be applying for full Medicaid. And then on the second page, we're going to look at in just a moment, there's some statements that you're going to need to read your applicant, because after you read the statement, they're going to have to verbally give their consent that they acknowledge it. And then you're going to make a determination to see if they're eligible or not. If they are eligible, then you're going to add the PE to GAMIS. And then after that, since they're not in the office with you where you can provide them with the forms, then you need to make sure you're either emailing or mailing them this information. Of course, they have to have written notice of what the decision was. So if they are eligible, then from GAMIS, when you enter into GAMIS, you will have the option to print a temporary certificate. So you're going to need to make sure a copy of that is included. The notice of action approval, the 634. If they were denied, then of course you're going to put the notice of action denial, a copy of the 5460. Remember, they don't have to sign it and, send it back to you. You're going to give them all pages. The notice of ADA, and then a copy of the assigned attachment A. We're going to look at the second page of this attachment A. So that's what you're going to be sending them, a copy of that. And that signifies that, they did this application over the phone and you signed on their behalf because they gave their consent. And then within 5 business days, of course, you're going to send your PE packet to DFACS. So this is the second page of the attachment A. And you're going to read this statement down here, all these statements, these paragraphs down here. You're going to read this to your applicants verbatim as it is listed here. So you're going to read this verbatim to your applicant, and then you're going to ask them, do you understand and agree to these statements? And they have to say yes or no. If they say yes, then you're going to go down here to the bottom, check the box where it says sign on behalf of, and then you're going to print the name of the person that you are signing, whose application you're taking. Put the date, print your name, and then you're going to sign it. If they do not agree to these statements, you're going to check the box no right here. But then you're also going to have to ask them an additional question. It says, if no, you need to ask, should I cancel this application? Because without your authorization, we are not able to process your application. So at that time, they're going to have to say another yes or no. If they say yes, of course, you're signed on their behalf. But if they say no, that's when the application process will stop and you don't need to go any further. So this is what you're going to be including in part of your PE pack if you do the interview of PE application over the phone, and then also either emailing or mailing a copy to your applicant. So those are the forms that you will be using for this particular program. And like I said, if you have any questions while you're viewing this training, please make sure you're jotting them down as you go. So what enrollment information do you need to provide to your applicant that have been approved, and also the ones that have been denied? For the ones that have been approved, you're going to provide them with all three of these: the quick guide, the understanding medical assistance book if they need it, and then the information about P4HB. If they were denied, then you're just going to give them the information about planning for healthy babies. So this is a copy of the quick guide, just giving them information that they have been approved for presumptive eligibility, and that their application with DFACS, their application will be sent to DFACS, and they will make a determination, and DFACS will notify them of the decision. And then it also let them know that once they have been approved for full Medicaid, they will be enrolled into one of the care management organization, one of the CMOs. And then if they have any questions about their case, or if they have any changes they need to make, they would need to make sure that they reach out to DFACS. So that's what the quick guide is about. And then your booklet. The booklet is just giving information about, how Medicaid works in Georgia, how you can apply to different types of programs that we have. Information about the card is in there. Also has some information about the CMOs in there as well. If you do not already have a copy of these booklets at your particular facility, this is how you can order them. You're going to go to the GAMIS web portal, which is www.mmis.georgia, spell it all the way out, .gov. Once you are on that website, you'll find at the top the tab that says provider information. You're going to click on that, and then you're going to select the one that says forms for providers. Once you click on that, then it's going to scroll down, then it's going to give you a list of all different types of forms that are located on this particular website. So you're going to go through all those forms and look for the one that says DMA 292. So once you locate that form, there's more than one page, so you may have to go to the second or third page. So once you have located that form, you're going to pull it up. You click on it and it'll come up. It's in a PDF file. It'll come up and you're just going to complete that form out in its entirety to indicate the number of booklets that you need. And then the address that you need to mail it back to is on that form. So you would mail back that form to the address that's on the form, and they will send you back those booklets, and they are free of charge. Okay, if a person has been approved or denied for presumptive eligibility, then you would need to provide them with some information about planning for healthy babies. So planning for healthy babies is just a demonstration waiver, basically dealing with family planning. And it's really good for people that are, pregnant, and then once they, roll off for pregnancy Medicaid after their 60-day postpartum, if they're not eligible for any other type of Medicaid class of assistance, then they may be eligible for planning for healthy babies. So it's just information on what planning for healthy babies is, what it can they get with this type of Medicaid, and who is eligible. It tells them who is eligible. And then this is like a front and back sheet information, and then on the back it tells you how you can apply and whether to send this information back to. So there are two information sheets for these. One is for new mothers, so if they just had a baby, then you would give them this one right here that says just had a baby. And then if they are just, young women that, need some type of coverage, then you would give them the one for the young women, and it'll just say be smart, plan before you start. So it just gives them information again about planning for healthy babies, what's covered, the eligibility requirements, and how they can apply. So now we're going to get into the bulk of this program. We're going to talk about the eligibility requirements, what it's going to take for someone to be eligible for this program. So we're first going to talk about non-financial eligibility. What are the non-financial eligibility and what are the verification for this? Of course, the person has to be a U.S. citizen or a qualified immigrant. And we're going to look at the citizenship policy to determine how can you determine if someone is actually a qualified immigrant. We're going to talk about that in just a moment. Of course, they have to be a resident of Georgia. It doesn't matter how long they've been here. As long as they state that they intend to live and stay in Georgia, they are considered a Georgia resident. Of course, they have to be pregnant. They cannot have had like a miscarriage or anything like that. They cannot have had the baby and be in their postpartum. That's not what presumptive eligibility is. It's only for women that are actually pregnant. Because if they've had the baby and they are still in their postpartum period, then they would need to just apply through DFACS for full Medicaid. Then, of course, they're going to have to meet the income limit, which we're going to look at. So they're going to have to meet it, cannot exceed the 220% of the FPL. So you are going to accept their statements with this information. So you're going to be asking them about their citizenship, immigration status. You're going to accept their statement. Asking them if they're a Georgia resident, you accept their statement. Asking them if they're pregnant, you accept their statement. If they have any income, okay, what is your income? How much do you get? All of that, accept their statements. There's no verification required. None. Now, if they give it to you, of course, you're going to take it. You can use it. And then you're also going to make a copy of it and send it as part of your PE packet. So DFACS will have it for their full determination. But otherwise, client statement is always accepted. Always, always, always. Client statement is always accepted. So now we're going to talk about the citizenship and immigration status. So on the 632, there is a question on that application. It's number 2, line 2. It says, are you a U.S. citizen or a lawfully present immigrant? So that's going to have to be asked because that determines if they're going to meet the citizenship immigration status. So how I would phrase the question to the applicant, you're going to first ask them if they are a U.S. citizen. If they say, yes, I'm a U.S. citizen, then of course, you check the box for yes. And then there's also a sworn statement on that application that they need to make sure that they understand that they are declaring under penalty of perjury that they are a U.S. citizen or a lawfully present immigrant in the United States. So if they're a U.S. citizen, that's fine. Check yes, and you keep it moving. If they say, no, I'm not a U.S. citizen, then this is where your immigration status policy will come into play. So if they're not a U.S. citizen, then the next question you can possibly ask, well, when did you enter or when did you come into the United States? So based off of that answer, that would determine how you would need to proceed. So if they came to the United States before August 22nd, 1996, then they're going to have to meet one of these criteria in number 1, either A, B, or C. So you would just go through the list to see if they meet one of these, if they came to the United States before August 22nd, 1996. If they meet one of these, great. They're considered a lawfully present immigrant. Check yes on that question. If they came to the United States on or after August 22nd, 1996, then they need to fit one of these criteria in number 2, either A, B, C, or D. If they can meet one of these, then hey, they're a lawfully present immigrant. So if you go through the criteria for number 1 and the criteria for number 2 based off of when they came into the United States, if they do not meet one of these, then they're not considered a qualified immigrant, and you would check no on that box, and their application would be denied because they did not qualify based off of their immigration status. So this is the citizenship immigration policy that you would need to have handy if you have someone that is not a U.S. citizen, and you just go by their date of when they entered the United States to see if they meet either number 1, the criteria number 1, or either the criteria in number 2. If someone comes in that's not a U.S. citizen and they give you an employment authorization document, or either you may hear it referred to as an employment authorization card, it doesn't matter. So if they come to you with this document, this does not verify their immigration status. This is only verify or telling us that they are authorized to work in the United States for a specific period of time, which is really temporary. But there are also immigrants like refugees and asylees that have to apply for this authorization card. So if you go back to your immigration status policy in number 1B or number 2B, if they're an asylee or a refugee, they are eligible based off their immigration status. They're considered a qualified immigrant. So if they come to you with this authorization card, you're still going to have to ask about their immigration status. So they're going to still have to tell you what their actual immigration status is. And then just go back to this immigration status policy to determine when they entered the United States and to see if they meet one of these criteria. Okay. Now we're going to get into the budget group. The budget group is very important because this is going to determine who's in the budget group. If they're in the budget group, their income is going to count. If they're in the budget group, they have to be listed on that application. Even though you're really doing the application for the pregnant woman that is the one seeking Medicaid coverage, she still has a budget group that she has to have. And if people that are in her budget group has income that we include, that income has to be included as well. And this also determines what the income limit would be for this particular applicant. So we have the income limit chart, and on the income limit chart that we're going to look at in just a few moments, it's going to go based off of their budget group size. Because of their whatever budget group size that they have, there is a certain amount that we have to compare their income to, and that's why we have to create a budget group. So for the budget group, you must have a tax filer or a non-tax filer relationship, and we're going to talk about that because we're going to go through what we call the budget group flow chart to determine whether they're going to be a tax filer household or a non-tax filer household. If the people should be included in their budget group, then their income is going to be included if it's income that we do include, because there are certain incomes we include and there are certain income that we exclude. So if it's income that we include that individual has, then that is income that would be counted, that would be looked at to compare it to the income limit. So let's talk about this, the budget group flow chart. So this is kind of very important. I want to make this a little bit bigger so everyone will be able to see it. So the budget group flow chart, this determines, like I said, if they're going to be a tax filer household or a non-tax filer household. Because if you go back to your 632, there is a question on there that you're going to have to answer, either a tax filer household or a non-tax filer household. And so you're going to use this chart to determine which one they're going to be. If they're a tax filer household, these are the people that should be included. If they're a non-tax filer household, these are the people that should be included, okay? And it's only the people that are listed in these boxes on this chart. If it's a person that is not listed in this box, that means they're not part of the budget group, so you would not include them on the application. You only include the people that are listed on this budget group flow chart. So what you're going to do is you're going to ask all of your applicants, every applicant that applies, you're going to ask them the same question. Do you expect to file taxes or be claimed as a tax dependent? And then based off of the answer to that question, you just follow the arrows to determine what filer rules you're going to apply, either tax filer rules, which meaning they're a tax filer household, or you're going to apply the non-tax filer rules, which means they're a non-tax filer household. So if you ask this question and the individual says, yes, I expect to file taxes, then you're just going to follow this first arrow that says yes, and you're going to apply tax filer rules. So if that person does file taxes, these are the people that should be included in the budget group and listed on that 632. So you're going to have the tax filer themselves. everyone that person is claiming as a tax dependent. So whoever she is claiming on her taxes, those individuals have to be listed on that application. If that individual is married and living with her spouse has to be included. And then we always count the number of fetuses she is expecting. So if she's expecting 2, we're going to count it 2. If she's expecting 3, we're going to count 3. If she's expecting 1, we're going to count 1. So we always count the number of the unborn fetus. So that is the budget group for a person that is filing taxes. If the individual says, no, I'm not going to file taxes and no one is claiming me as a tax dependent, then you're going to follow this long arrow that says no, and it's pointing to this box that says apply non-filer rules, and this is non-tax filer. So if the individual is an adult, you're going to include of course, the adult. If the adult is married and living with the spouse has to be included. And the catch is they have to be married and living together. Adults' children under the age of 19 if living together, and also the unborn fetus. If the individual is a child, you're going to include the child. If that child is living with her parents, then the child's parents have to be included. If the child has any siblings under the age of 19 living together, those siblings have to be included, and then also the unborn fetus. So that's when you apply non-filer rules if they say no, they do not expect to file taxes or be claimed as a tax dependent. And then the middle box is if you ask this question and they say, well, yes, someone is going to claim me on their taxes. So if that's the case, then you're going to follow this arrow that says yes, and it's pointing to this box. It says, does the tax dependent meet a tax dependent exception? So what you're going to have to do is to go through these exceptions with your applicant to determine if they meet one of these exceptions. If you go through these 3 exceptions and they do meet one of these exceptions, then you're going to follow this arrow that says yes, because they meet one of these exceptions. If that's the case, then you're going to apply non-filer rules. And these are the people that should be included. If you go through these 3 exceptions and they do not meet one of these exceptions, then you're going to follow the arrow that says no, and it's pointing to the box for tax filer rules. So that's when you're going to apply the tax filer rules. And then for that individual, the budget group is going to be the same as the person that is claiming them. So it's going to be the actual person that is filing the taxes. So whoever is claiming them, that individual has to be on that application. And then everyone that person is claiming besides the actual applicant. So if the person that's filing the taxes is claiming just the applicant, then it's just be the applicant. But if that person is claiming the applicant and 3 more other people, those other 3 people have to be included. If that tax filer is married and living with a spouse, that spouse has to be included, and then also any unborn fetus. So the 3 exceptions are, the first one is if the applicant says, yes, I'm being claimed as a tax dependent, then you're going to ask, well, the person that's claiming you, is it your parent or spouse? If it's someone other than a parent or a spouse, that means that they meet this exception, so you're going to apply non-filer rules. If that tax dependent is under the age of 19 and living with both of their parents, but their parents are filing separately, and then one of the parents is claiming them on their taxes, then they meet this exception right here. And then the last one is that child is under the age of 19, expects to be claimed by a non-custodial parent. That means that that individual is staying with one parent, but being claimed by another parent that lives, somewhere else. So that person will meet exception 3, and you will apply non-filer rules. So again, they're either going to be in the tax filer household or they're going to be in the non-tax filer household. And based off of what rules that you apply, you only put these individuals that are listed in the boxes on that application. If you have any more questions about this, please make sure that you're writing them down so they can be answered. Now we're going to talk about our income. So what income are we looking at? And we're looking at modified adjusted gross income. That's what MAGI stands for, modified adjusted gross income. And this is based off of, IRS rules, and that's how the tax filer, non-tax filer information came into about. This ties into the MAGI-based income. So MAGI-based income is just taxable income that we're going to use in their budget. And it can be taxable income. It could also be other income that are not taxable, like Social Security benefits. There are some Social Security benefits that are not taxable, but we use Social Security benefits. There's tax-exempt entrance or either foreign earned income. We're going to use that in the income budget. Most of the income that someone has, of course, is probably going to be income where they're working or either receiving unemployment. But if they're working, it could be in the form of wages, salaries, commission. It also can be self-employment. Okay, not only are we collecting the income, we also collect information about deductions. And we collect information about deduction because this information is very vital. If the applicant has these deductions, these are things that can be subtracted from their gross income to lower their income amount when we're comparing it to the income limit to try to make them eligible. So there are three types of deductions that we're going to look at. We have the pre-tax deduction, the Form 1040 deduction, and then the 5% deduction. These two deductions, the pre-tax and the 1040 deduction, if they have either one of these types of deduction, those can be automatically subtracted from their income. But for the 5% deduction, this is only going to be subtracted if it is needed to make that person eligible. So if you look at their income and they're over the income limit, then yes, that's when you will use the 5% deduction. But if you compare their income to the income limit and they're under that, or they're at or under that, then that means that you do not need to subtract the 5% deduction because they're meeting it, okay? So the 5% deduction is only given if it's needed to make them eligible. The next couple of slides we're going to talk about is the pre-tax and 1040 deduction. So I just kind of gave you just a reference for your information only, just to show you what pre-tax deductions are. And on your paycheck, these are the deductions that are subtracted off of your gross income before taxes are taken out. So if you have anything like vision insurance or 401k, health insurance, dental insurance, things of that nature, those are types of deduction that are subtracted off of your income before taxes are taken out. And they have to be before taxes are taken out because some deductions are taken out after taxes. It just depends on that particular applicant, how they have that information set up. But you would ask them, do you have any deductions, especially if they're working, you're going to ask them, well, do you have any deductions that are taken out of your check before taxes? And you can give them some examples so they know what you're talking about. So again, they don't have to show you their paycheck stub. You just ask them that question and they just tell you. Whatever they tell you, that's what you go by. Form 1040. So this is the Form 1040. This is the IRS form. And this is Form 1040. And we're going to be looking at these deductions that can be subtracted off of someone's income. And it's only the deductions that are shown between lines 23 through 36. So if they have one of these types of deductions, and this is why I'm giving you this for your information, because you need to know what is considered a 1040 deduction. So like, for instance, if they have student loan interest or IRA deduction, moving expenses, if they're part of the armed forces, that can be subtracted off of their income. The one that has the asterisk by it is the alimony. because it depends on when the divorce or the separation was finalized or last modified. That would determine if we will be able to give a deduction for that or not. So in the instance that the divorce or the separation was finalized or last modified before January 1st, 2019, we can't allow it as a deduction. So if they say that they're paying alimony out, this is something that you're going to have to kind of question about. Well, when was your divorce or your separation finalized, or when was it last modified? If they give you a date before January 1st, 2019, you can allow it as a deduction. But if it's a date on or after January 1st, 2019, we can no longer allow it as a deduction. So after 2019, it is no longer allowed. Before January 1st, 2019, you can still allow it as a deduction. So that's the only asterisk that I have for that. So again, this is the 1040 deductions. Okay. This is the income limit chart, and this is the income limit chart that you're going to be using to compare someone's income to. And remember, I told you it's going to go based off of their budget group size. So if the budget group size is supposed to be 3, then their income cannot exceed $4,026. And this is a monthly amount. So this is a monthly amount that they cannot go over. So if they have a budget group of 4, that means their income cannot exceed the total income. So if it's not only the applicant, if it's like an applicant and her husband, so their income together cannot exceed $4,859. Okay. And then the 5% deduction, what I was telling you about, remember that is only given if that individual needs it to make them eligible. So that means that their income is over the income limit. So if that's the case, you would use these amounts to subtract off of their income. So let's say, for instance, it was a household of 2, and you calculated the whole total income come out to be $3,200. So if I'm comparing that $3,200 to the income limit for a budget group of 2, the income limit is $3,194. If I compare that to $3,200, that means right now that individual is ineligible. So in order to see if that individual will be eligible, what I'm going to do is subtract $73, this is the 5%, from the income amount. The income amount that they had, the whole household had, was $3,200. So you're going to subtract $73 from $3,200, and now the income drops down to $3,127. And now when we compare that amount back to this $3,194, the applicant is now eligible. So that's what I mean by only using it if it is needed to make the person eligible. The income limits here listed here is for 2021, and these are effective March 1st, 2021. These income limits change every year, so they're going to change every year around this time. So you're going to use this until you get the next set of income limits, which would be 2022. So every time these income limits changes, you will get the new income amounts every year. So make sure you're using the new income limit chart for 2021, effective on March 1st. Okay, now we're going to get into the conversion factors. So when someone has income or they have deductions, and they do not give you that amount, since you're accepting their statements, and they do not give you an amount that is in a monthly amount, because the amount has to be in the monthly amount before you compare it to the income limit chart. So if they give you an amount that is not in a monthly amount, then what you're going to have to do is to use what we call a conversion factor. You're going to have to use a conversion factor to convert that amount over to a monthly amount. And it's going to be based off how often they get that income, or either how often they pay those deductions. So for instance, if someone is paid $300 every week, instead of you multiplying 300 times 4, because that's what we would probably normally do in the real world, Well, for Medicaid purposes, you're not going to multiply it by 4. You're going to multiply it by 4.3333, and that's going to be your amount. So in my calculator, what I'm going to do is to put 300 times 4.3333, and the calculator gives me $1,299.99. So that will be the monthly income for that particular individual, and that's the amount that you're going to compare to the income limit. If the person is paid every 2 weeks, then you're going to take the amount and multiply by 2.1666. So take that same $300, and now this person is paid every 2 weeks, so take 300 times 2.1666, and the calculator gives me $649.98. And that's the monthly amount that you compare to the income limit. If the person is paid only twice a month, they're not paid every 2 weeks, they're paid just 2 times out the month. They're paid just 2 times out the month, then you're just going to multiply by 2. So in that instance, let's still take the $300 and multiply by 2, and the income is $600. And then if someone gives you a yearly amount, you just divide that by 12. And you'll use these same conversion factors for deductions. So if someone is say, yes, I pay for health insurance $80 every 2 weeks. So what you're going to do is take that $80 and multiply it by 2.1666 to get the monthly amount for that deduction. So make sure that you are using the conversion factors when it comes to converting income or deductions to a monthly amount. And we're going to go over a couple of examples so you can see what we're talking about. So an applicant works and earns $189 every 2 weeks. What is the monthly income? So what you're going to do is to take that $189 and multiply by 2.1666 because they're paid every 2 weeks, not twice a month, but every 2 weeks. Once you multiply that, 189 times 2.1666, you multiply that, your income amount comes out to be $409.48. Now the calculator gives you $409.4874. You take off the other digits that are after the decimal. You're only going to use 2 digits after the decimal, right after the decimal point. All the other digits can be left off. So you're going to just put 409.48. Number 2, an applicant receives workers' compensation of $225 every week. What is the monthly amount? The conversion factor for weekly is times 4.3333. So in your calculator, you're going to put 225 times 4.3333, and you should get $974.99. And I'm sorry you all are seeing these answers already because I don't have it in the slideshow view, because I want to make sure you all are able to view the slides because some of the information on these slides are pretty small. The next one is you have an applicant that pays $25 for dental insurance semi-monthly. What is the total monthly amount for the pre-tax deduction? Semi-monthly means only twice a month. So you just take 25 and multiply by 2 and you should get 50. So again, use your conversion factors based on how often they get the income or how often they pay those deductions. Now, you may have someone that gives you income that is not always the same, meaning that every time they get paid, it's a different amount. So we call that fluctuating income. And if you have someone that has fluctuating income, this is how you would need to calculate their income. First, you're going to add up all of the pays that they gave you. So again, they can just tell you this. Someone tells you, I work, I was paid $320 one week, $300 the next week, $209 another week, $284 another week. So what you're going to do is you're going to add those pays up together to get your sum amount. So once I added those pays up that are listed on this slide, I got $1,194. Once you add that up, then you need to do an average of all of those pays. So to do an average, we divide by the number of pays that they gave us. So in this scenario, it was 4 pays that they gave us. So we're going to take that $1,194 and divide it by 4. Once we divide it by 4, our amount comes out to be $298.50. Now what you need to do, that is just the weekly average amount, or the bi-weekly average amount. That's just your average amount of what they would probably get every time they're paid. So in order to convert that over to a monthly amount, we're going to take that $298.50 and convert it over to a monthly amount based on how often they get paid. So if they're paid weekly, you multiply it by 4.3333. If they're paid bi-weekly, you multiply by 2.1666. If they're paid semi-monthly, you multiply by 2. And then if they're paid monthly, you multiply by 1. So again, fluctuating income, you add all of the income up together to get your sum amount. Then to get the average pay, you're going to divide by how many pays that they gave you or received. And then you're going to take the average pay and convert it over to a monthly amount by multiplying by the correct conversion factor. Okay, let's go over the examples for fluctuating income. So, number 1, an applicant works and is paid every week. The applicant was paid $225, $230, $235, and $245. What is a monthly income? So what you're going to do in your calculator, and remember when you're doing calculation, please make sure you're clearing out your calculator each time so it doesn't interfere with your calculation. So you're going to put in 225 plus 230 plus 235 plus 245. And that should give you an amount of $935. So once you add all of those pays up, that's the amount that it gave you. 225 plus 230 plus 235 plus 245. Now you need to divide that by how many pays that they receive. And in this example, they received 4. So you're going to take the 935 and divide it by 4. And your average amount is $233.75. Now that's just your average for the week. So to convert that amount over to a monthly amount, we need to use our conversion factors. So for weekly, we're going to take that 233.75 and we're going to multiply by 4.3333. And your answer should be $1,012.90. Not 91 cents, not 1,013. You don't round it. So it's always $1,012.90. Your next example, number 2, an applicant works and is paid every 2 weeks. The applicant was paid $1,150 and $1,167. What is the monthly income? So in your calculator, you're going to put $1,150 plus $1,167, and you get $2,317. Now you divide that by 2 because they only gave you 2 pays this time. So you divide that by 2. And your average amount comes out to be $1,158.50. So that is just your average, but we need to convert that over to a monthly amount, and they're paid every 2 weeks. So you'll take that amount and multiply by 2.1666. And your income should be $2,510, and that is letter D, none of the above, or none of these. Again, $2,510. An applicant worked and is paid monthly. The applicant was paid $2,500 plus $2,670. what is the monthly income? So in your calculator, clear it out. Put in 2,500 plus 2,670. That's going to give you amount of 5,170. We need to divide by the number of pays that they receive, which is 2. You get 2,585, and they're paid every month, and the conversion factor for monthly is just times 1, so it's just going to be times 1, and it's still the same, $2,585. So that is how you would calculate fluctuating income. Again, add up the pays, then divide by the number of pays received, then use your conversion factor based on how often they're paid to come up with the monthly amount. Okay, like I was telling you earlier, there are certain types of income that we do not include in the budget. And so if it's income that we do not include, then we're not going to put that type of income on the 632. They still need to display that income on the full application with defects, but for purposes of presumptive eligibility, do not enter that income on the 632, because if you put it on the 632, then you're going to try to include it when it should not be included. And some of the examples of excluded income, this is not an all-inclusive list, but some of the most familiarized type of income that we commonly know or familiarized with is like child support, SSI, adoption assistance, contribution, things of that nature. They are not included, so that means it should not be listed on the 632. If you go to the policy manual that is listed on the GAMIS web portal, and once you pull up the policy manual for PE pregnant women, if you go to Appendix I in that manual, it will give you a whole list of income. It's a chart, and it'll give you a whole list of incomes, and it will tell you whether you include that type of income or exclude it. Now, in that income chart, you may see it's going to give you like the list, the name of the income or the type of the income, the description of the income, and then in the third column, it'll tell you whether it's going to be included, with which it would represent as an I, and then it'll tell you whether it's excluded, represented with the E. So if you look at that column, if it has the word magi in parentheses or the word non-magi in parentheses, make sure you are associating that with the one that says magi, because presumptive eligibility, remember we've seen that in a previous slide, we're looking at magi-based income, so it has to have the word magi in parentheses beside it. If you go to an income and it doesn't have magi or non-magi, that means it is excluded or included for both programs. But if it is listed, make sure you're using the one that says magi. And then the one down here about the Rsdi income, this is income that a child can receive on the behalf of, like a deceased parent or something like that. So if you have a child that is receiving Rsdi, who has no other income and they live with their parent, that income will be excluded. You would not include the Rsdi income for that child. The asterisk to that is, this is where it will be included. So if that individual has other income that meets the IRS tax filing threshold, and the IRS sets, tax filing threshold, meaning if you have income that is over this amount that is set by the IRS, that means that you're required to file a tax return. But if you have income for that year that is below that, that means you do not have to file a tax return. So if they have other income that meets the IRS tax filing threshold, meaning their income, the Rsdi along with the other income exceeds that threshold, or if the child does not live with their parent, they live with somebody else, it can be their brother, their sister, their grandmother, their uncle, and then their parent is not claiming them as a tax dependent, that's when the Rsdi will be included. So that would be a situation where a child is living with the grandmother, they have other income, the child's living with the grandparents, and the child's parent is not claiming them as a tax dependent, that's when it would be included. Or either the child has the Rsdi income along with other income and it's over that IRS tax filing threshold amount, then that income would be included. Not sure how many times you would see that, but I just wanted to give you that information in case you are, you come up with this type of situation where one has Rsdi. Okay, that is the section over non-financial and financial eligibility. But like I said, if you have any questions, please make sure you are writing those questions down. Next, we're going to get into the procedures and the PE manual updates. Remember, I was telling you earlier, there are certain procedures that you would need to follow. So these are the procedures that you would need to follow. And then there is a update form that you would need to complete if you are presented with certain types of situations. Early in the presentation, I told you the first thing you need to do before you start any PE applications is you need to screen your particular individual into GAMIS to see if they're already active or not, and to also get their ID number if they are known to the system. When you are screening someone, you need to make sure you are asking about any other previous names that they could have applied up under. Because sometimes they may either get married, or they may get a divorce and they change their name, or either they just change their name completely from the previous time when they did apply and was approved for Medicaid. So you're going to ask for any previous names and also the spelling of their names. And that's because if you don't, then the system may look as if they never had Medicaid when they probably actually have had it. And because we don't want to create a new ID number for them. The ID number that was created for them the first time, that's the ID number that needs to stick with them throughout their lifetime. So after you screen the person and it is determined that they can apply for PE, then this is what you would need to do. You complete the PE applications and all the other required forms, determine if they're going to be eligible or not. If they are eligible, you're going to add the PE to GAMIS. Tell your applicant what their PE period is. Remember, it's the application date through the end of the next month at the end of the month. Let them know that their full application will be sent to DFACS for processing. And then you provide them with the quick guide, the notice of action, the approval notice, and then a temporary certificate, which you will be able to print from GAMIS. Understand the medical assistance booklet, notice of ADA, and the P4HB information. And then you're done with that person. If the person is determined ineligible, then you're going to inform the person that if your circumstances changes, you can come back and apply for PE. They do not have to wait those 2 years, they do not have to wait for another pregnancy. If their circumstances changes, they can come back and reapply because they haven't been approved. So if their circumstances changes, they can come back and reapply. Provide the applicant with a denial notice, which is the 634, and the P4HB information. And you're going to inform the applicant that their application for full Medicaid will be sent to DFACS for processing. And let me put this, disclaimer out here. Just because an individual was approved for presumptive eligibility does not mean that they're going to be approved for full Medicaid. It just depends. That's why you all do the PE determination and then DFACS will do the full Medicaid determination. So they have to go through their process for the full side to see if that actual member will be eligible. So don't tell them that they're going to be eligible. Well, we're sending your application over to DFACS, but you're going to be eligible. Don't tell them that because you don't know that. And then vice versa, just because they were denied for presumptive eligibility does not mean that they're going to be denied for full Medicaid. Okay, so just wanted to make sure that you all understand that. Okay, if you screen someone, it shows that they're active. And remember, I showed you a list of the full Medicaid aid categories. So if it shows that they're active on one of these aid categories that we're going to go through, these are the procedures that you would need to follow. The first one we went over is the P4HB, the 180 or 181. So if they're active on P4HB 180 or 181, then you're going to go back to the steps that we just went through with number 2 to make a determination to see if they are going to be eligible or not. Once you have done that, then you're going to need to fill out a PE manual update form, and you're going to send this information over to DCH, and that will let us know that we need to terminate that P4HB case. And we'll look at the PE manual update process in just a moment. If the individual is active on Women's Health 245, then they need to report their pregnancy to DFACS. They go online to Gateway. They can also call the one, I know it's not listed here, but they can call the 1877 number, or either you all can send an email to the Women's Health email address. And we've seen this earlier in our presentation, so this is not new. If they're on SSI, remember the only thing you will need to do is to complete the SSI Pregnant Women Update form and email that to the PE corrections box. And I do want to also put this out. When you are sending information via email, please make sure that it is sent securely. That means if you have to encrypt it or send it with a password, or however your IT department has, your security set up where information that you send is sent secure, please make sure you're sending that information securely. Okay? And that's either to DCH or to DFACS. Please make sure you're sending that securely. If you have an individual that is active on Q-Track, then this is what you would need to do. You will treat them like the P4HB individual. You'll go back and you will do a P determination using number 2 on the previous slide to make an eligibility determination. If they are eligible, of course, you add it to GAMAs and all of that. And then once you're ready to send your PE packet to DFACS, you're also going to be emailing me a copy of your PE packet, and it's directly to my email address. And in the body of the email, just make sure you put like member approved for PE, but also active on Q-Track. And what it is, I just have to monitor these applications because once if the member is approved for full Medicaid, their Q-Track case is going to close. And the Q-Track case is really just, paying for their Medicare premiums, is not really full Medicaid. So once they come off of the pregnancy Medicaid after their 60-day postpartum, then we want to make sure that they go back to that Q-Track case that they were on prior to the pregnancy Medicaid. If someone is active on Inmate Medicaid, remember they have to have been released. So if they have been released, you're going to ask them now. If we screen them and it shows that they're active on Inmate Medicaid, you're going to need to screen them. You're going to need to ask them if they have been released. If they have been released, then of course you're going to complete the PE application process to determine if they're going to be eligible or not. If they are eligible, once you have completed all of your forms, and if they are eligible, you will not add the PE to GAMAs. Instead, you're going to send me the 632, a copy of the 632, along with their release date. You're going to send it directly to my email. And what I would do is I have to verify their release date to make sure that they actually have been released. And once I'm able to verify that, then I will go in and add that PE to GAMAs and reach out to the member to let them know that their coverage, that they now have coverage has been added to the system. And then you will still send your PE packet to DFACS for processing. For all of the aid categories listed in that chart that we went over previously, make sure you refer them over to DFACS. If an applicant is approved but later finds out that they're no longer pregnant and you know about this information, please send this information to DCH via the email to the PE corrections email address. and you're just going to give us the member's name and ID number. If you have a copy of the negative test results, you can attach that as well. So once we get this information, we will go into gammas and terminate that PE coverage. And the last one for the PE procedures, this is the one that I was talking about earlier, especially about you keeping a record of the applications you sent to DFACS, because this is when number 5 will come into play. And I get this a lot. You may not get it a lot, but you may get it a time or two. So you would need to know what procedures that you need to follow. So if you have a member who previously was approved for presumptive, but later comes back, they either come back to the same health department they apply, or they may go to another health department. All they know is that they don't have Medicaid coverage anymore, and they want to know why. And so if that's the case and they come to you about this, what you're going to do is to follow these steps. You're going to screen the person into gammas to see if their Medicaid coverage has actually ended. If it has, if the member applied in your office, I need you to try to locate that PE packet for me. If you cannot locate it, that's fine. Or either if the member did not apply at your office, that is fine as well. But if you do have it, you're going to send an email whether you have it or not. If you have it, attach the application packet to the email. If you don't have it, just let me know, hey, she did apply here, but I cannot locate the packet, or either she did not apply here. And you're going to give me the member's name, ID number, and give me kind of a brief description of what's going on. Once I receive this information, then I would take it and research it to actually see what happened of why that full application, because 9 times out of 10 is about the full application that hadn't been processed. Either there was some lack of it, there was some discrepancies, or something fell by the wayside when it was being routed from you all to DFACS. I don't know what happened. That happens, sometimes. It also happens sometimes where the application is sitting in Gateway, but nobody has processed it, or either it was denied and the member is saying that they haven't gotten any notifications or anything like that. But what I do is I have to research further to actually see what's going on. And then either I can reach back out to the member to let them know the next steps, or either I can send the information back to you to let you know of what to advise the member. So again, if you have that situation where the member was previously approved but no longer has coverage, then you need to make sure you're following these procedures right here. So we're talking about PE packet. So when we're talking about PE packet that you sent to DFACS, this is what should be included in your PE packet. So this is kind of like a checklist for you all to make sure that you have this information when you're sending it to DFACS. So the first PE packet we're going to talk about is just a normal PE packet. So this is for if we, once COVID-19 is over, the doing applications over the phone is no longer going to be in existence. So we're going to go back to our normal process where people will have to come in to apply. So that's the PE packet that we're talking about. So in those packets, this is what should be included: your 632, your 5460, which is the signature page only. Remember, all the other pages should go to your applicant. The 634, the 94A, which is the full application, the notice of ADA, the DMA 285 if applicable, and then also if they have other health insurance and they have a copy of their card, make a copy of the front and back and send it. If they have a copy of their ID, you're going to ask them, even though we don't need it for presumptive, it is good to get a copy of it so that way DFACS does not have to ask for it, and that can kind of speed up the process because this verifies their identity. So if they have a copy of their ID card or their ID, please make sure you get a copy of that and send it as part of your PE packet. And then if they provide you with any type of verification, please make sure you make a copy of it and send it as part of your PE packet. So again, this is kind of like a checklist to use just to make sure that you have everything including your PE packet before you send it to DFACS. So now we're going to get into the PE manual updates that we were talking about earlier. When will I fill out a PE manual update form? These are the reasons why you will fill out a PE manual update form. If you're unable for some reason to add the PE to GAMIS, either GAMIS was down or your internet was acting up, or like I said earlier, a member recently had Medicaid, pregnancy Medicaid, and so you know they have pregnancy Medicaid, their due date is out there. But for whatever reason, let's say that Medicaid coverage ended, and now it's like 2 months later and she's pregnant again. So in that case, her pregnancy information from that previous pregnancy is still out there. And so when you go in GAMIS trying to add it, it's not going to allow you. It's going to give you an error message saying that the pregnancy is less than 7 months. So if that's the case, that means you cannot add it to GAMIS. So that is when you would need to fill out a PE manual update form. If the P4HB needs to be terminated, you will fill out this form. And then also, if any information about a member is inaccurate and needs to be updated, and you're not able to update it while you're adding that person to GAMIS for the PE approval, because some information you are able to update while you're adding that person, but some of the fields will be grayed out, which means you cannot update it. So if that's the case, that's when you will fill out this form. When you have to fill out the form, we're going to go through of how to complete this form accurately, because not everything on this form has to be completed. And we'll go through that in just a moment. And then once you have the form completed, you're going to send this form along with the copy of the PE application. And then if you did this application over the phone, you're going to also attach a copy of the attachment A. And you're going to send it to the PE corrections email address right here. If you are updating some information about the member, like their name, their date of birth, social security number, or citizenship, that is information that DCH must have to verify before we're able to update it. So if either one of these items needs to be updated, you're going to ask for a verification of it if they have it. If they have it, please attach verification to this email that you're sending. So let's look at the form. This is what the form looks like. Try to make it as big as I can so you all can see it. So this is what the form looks like. Right here it tells you where to email it to, and it tells you what to put in the subject line. I know this is, the red is kind of, there it goes. It tells you what the subject line should be. So you're going to put the date that you're completing this for, and this really should be the same date that you're doing the application, because the date that you do the application should be the same date that you're filling out this PE update form and sending it to us. You're going to always check this first box where it says Pregnant Women PE. You always check that box. And as a reminder, we have down here where it says Attach Form 632. So that gives you a reminder. When you're sending this form, you need to make sure you are attaching the 632 with it. If we scroll down a little bit, so this is the section that you need to complete, but you only need to complete the fields that needs to be updated. And it tells you right here, please check below which update needs to be completed. So if it's the name that needs to be completed, you're going to check the box where it says name, and you're going to write in what the correct name should be. If it's the address, you do the same thing. Same thing for social security number, date of birth, and all of that. But let's go for instance, if it's just a P4HB. So if a person is active on P4HB, then you know that that P4HB case needs to be terminated. So in that case, after you check, put the date, check the box for pregnant women, you're going to check the box where it says terminate P4HB. You're going to go down here to the bottom, print your name, print your telephone number, and that's it. Do not put the name, address, social security number. I don't need all that information. You are sending the 632, so that's how we would get the information of who this update is for. Only thing you need to do is to check the box where it says terminate P4HB. If for some reason you're not able to add the PE to GAMIS once you have approved them, then here are the fields that you would need to fill out. First, you need to give us what the due date is. So this is the form, the field you would need to fill out: expected birth date of fetuses. Then you would need to tell us the number of birth, how many babies that person is expecting. Then you go down to the field where it says add PE eligibility to gametes. You're going to check that box. And then over here, you're going to say, it says PE eligibility period. That's when you're going to give me the PE period. Give me the start date through the end date. So again, if someone was approved on March 1st, then your PE period would be March 1st, 2021 through April 30th, 2021. Then you go down here, print your name, and put your telephone number. So again, this is only to be completed if you're not able to add it to gametes, if the information for the member is incorrect and you're not able to update it, or either if the P4HB needs to be terminated. That's when you will use this update form. Okay, so we're going to move on. Just a little smaller. Now we're going to get into the telephonic signature procedure. Like I said, you have two options. The member can be interviewed. They have to come into the office to apply with you, or either if your facility wants to do applications over the phone, this is the process that you would need to take. And remember, this is only to be used during the COVID-19 pandemic. So once the COVID pandemic is over, then this will no longer be in existence. So the first thing you would need to do, of course, this is just for everybody. You would screen the individual into gametes first. Once you have done that, then that would determine if you're able to go ahead and do a PE application on them. If so, you go ahead and complete your interview with them so you can complete the PE application. Then you're going to get your attachment A, and you're going to read those statements off of the second page, because the first page is just, the step-by-step that you would need to take. So the only page you're really going to be filling out each time is page 2. So you're going to read those statements verbatim to your applicant. Your applicant would need to acknowledge their consent. Then if they do, you will make an eligibility determination based off of the information that you have to see if that individual is eligible or not. If the individual is eligible, then, excuse me, then you're going to complete the 94A on their behalf. Remember, it's over the phone. You need to complete all of the forms. Then you're going to add the PE to gametes. And then you're going to email or mail your applicant the temporary certificate, the notice of action that they were approved, the 5460, the notice of ADA, and a copy of the signed attachment A. Inform the applicant what their PE period is and what services are covered, and then you will send your PE packet to DFACS. You need to make sure these packets are sent to DFACS within 5 business days from the date of application. I prefer you to send these daily, like I was saying earlier. Try to send these daily, but you have at least 5 business days to send them to DFACS. If the individual is determined ineligible, of course, again, let them know if their circumstances changes, they can come back and apply for PE. And then you're going to email or mail them the notice of action, which is the denial notice. Still send them a copy of the 5460, the notice of ADA, a copy of the signed attachment, and then you still complete a 94A on their behalf and send that PE packet to DFACS within 5 business days. So it's just the same process that you would normally do, except that they're not signing anything and you are filling out everything on their behalf, and that assigned attachment A serves as signature for the PE application. It will also serve as signature for the 94A, which is the full application. So you have to make sure that that attachment A that is signed on their behalf, it is a part of your PE packet, because that serves as the signature. Because without that, then that means that that application is not is void. It's not complete and it can't be processed. So when you do an application over the phone, here's the PE packet for that. So here should what should be included in your PE packet for a telephonic signature application. Of course, you have your 632, your 634, either approval or denial, the notice of ADA, the signed attachment A, the 94A, and then the DMA 285. And also with the 94A, remember there were 3 attachments associated with them. So if it is applicable to that person, then you would need to make sure to fill out attachment A, B, and C on their behalf. And remember, the attachment A will serve as their signature on those if there's a place for signature on those attachments. So what are the reasons why someone can be denied? First, of course, if they're not meeting the U.S. citizen or immigration status, they can be denied for that. If they are not a Georgia resident, of course, if they're not pregnant, and then if their income is over the income limit, even after the 5% deductions or all the other deductions that we allow. So if they're still over the income limit, they can be denied for that. And then if you just have someone who just, refuses to cooperate and give you the necessary information that you need in order to make a P determination, then they can be denied for that reason, for not cooperating. Okay, so now we're going to get into our examples. Of pregnant women. So what is the eligibility criteria again? Remember, they have to have a tax filer or non-tax filer relationship. So they're either going to be a tax filer household or a non-tax filer household. And remember, if they are a tax dependent, you will have to see if they meet one of those exceptions. And then based off, once you go through those exceptions, that would determine whether they're going to be a tax filer or a non-tax filer household. They must meet the income limit, be a Georgia resident, a U.S. citizen, or a qualified immigrant, must be pregnant, and remember, they can only be approved for presumptive once per pregnancy. So it has to be each time they are pregnant with a new pregnancy. Okay, so we're going to go through a couple of examples, and we're going to go through a couple of examples of how to fill out this application. I think I have an example how to fill out. The examples are going to be how to fill out an application. I'm going to give you a scenario. We're going to go through how to fill out the application, and then we're also going to look at how to fill out the PE manual update. I have a scenario for that, and then a scenario once a person called in. So how to fill out the attachment A as well. So the first example is I have Mercedes Harry, who's 42. 12 weeks pregnant with twins. She lives with her husband, Kodak, and her son, Kodak Jr. Mercedes works at Lowe's and earns $34 per hour. She works 40 hours a week, and she's paid every week. So this right here tells you you're going to have to do some calculation, and we're going to have to use our conversion factor. Kodak, her husband, does not work. Mercedes pays $29 per week for health insurance and $16 per week for dental insurance. So there's another place where we're going to have to use our conversion factors. She states she intends to file tax leave jointly with her husband and claim Kodak Jr. as a tax dependent. Mercedes calls and wants to apply for PE. So this is the application that we're doing over the phone. So the first thing we're going to look at is our steps that we're going to go through. So the first thing you're going to do, of course, you're going to screen Mercedes into Gammas to actually see what it's going to tell us. So for this example, this is just for training. This example, when we screen Mercedes into Gammas, it shows that she is inactive. So that means she had Medicaid before, but she's inactive right now. And they gave us her ID number. So we're going to write that number down because that's the number that we're going to use for her indefinitely. And this number can go on your PE application. You're going to complete your 632. You're going to read your attachment A, those statements on the second page, read them verbatim to Miss Harry. She needs to acknowledge and give her verbal consent, and then you're going to sign on her behalf. Now you're ready to make an eligibility determination. Based off of the information she gave us, is she eligible or is she ineligible? If she is, we will add that PE to GAMIS, and we will also complete the 94A on her behalf because she's not there with you. Then after you've done that, or this can be towards the end, you're going to mail your applicant the 634 approval notice, the temporary certificate, which will be printed for GAMIS, the 5460, the notice of ADA, and a copy of the assigned attachment A. And you will let her know that her full application will be sent to DFAX for processing, and you need to send that application within 5 business days. So the first thing we're going to look at is we're going to look at the budget group, and then we're going to look at her income. So budget group, she was filing taxes jointly with her husband and claiming everybody. So if filing taxes, that means they are considered a tax filer household. So everybody in that household should be a part of that budget group. So it's her, her husband, their child, and then the unborn twin. So that is a budget group of 5. Then she had income. She was working at Lowe's, $34 an hour, working 40 hours a week. So you multiply the 34 times 40, you get $13.60. Then you take that, because that's just your weekly amount because she's paid every week. You multiply that by 4.3333 and you get $5,893.28. So that is her income as of now, right now. But remember, she was paying health insurance and she was paying dental insurance. For the health insurance, she was paying $29 a week. So we need to convert that to a monthly amount. So we take that 29 and multiply it by 4.3333, and you get $125.66. You take that dental insurance, which was she was paying $16 every week. You multiply that by 4.3333, and you get $69.33. Now what we need to do is subtract those 2 deductions from her income, because those are considered pre-tax deduction. So you just take her income and you subtract both of those deductions from her income, and her income is now $5,698.29. So if you look at your income limit, let's look at the income, let's look at the subtotal net income first. So if you compare her income to the income limit chart, it's a budget group of 5. And the income limit for a budget group of 5 for pregnant women is $5,690. Is that 91? Budget group of 5, it's $5,691. If you look at it, she's at $5,698.29. That means she's over. So in order to make her eligible, then we're going to subtract the 5% deduction. The 5% deduction for a budget group of 5 is $130. So we subtract that, and now her income is $5,568.29. So now she is eligible. So that's why I said you only use the 5% deduction if it is needed. So this right here is just information that you use in order to fill out the PE application, but we're going to go ahead and just go through this one so you can see how to fill it out completely. We want to make it a little bit bigger so we can see, so you all can see it. So the first thing we're going to do is to put the date that she applied, and she applied on March 2nd, 2021. Remember, it gave us her ID number when we screened her into GAMIS, so we're going to put her ID number up here. And the ID number is always 12 digits long. So you know your, if you have enough digits, make sure you have enough digits, 12 digits long, and also make sure that that ID number corresponds to that particular person. And then you want to put her demographic information up here at the top, her name, address with the lot number or apartment number, city, state, this is supposed to say state, zip code, and county of residence. She has a maiden name she wants to give you, she can put that. Put her telephone number. For presumptive, the social security number is optional, it's not required, but it will be required on the 94A. Over here is just giving you some types of abbreviations that are letters that you can use for the type of income that they have that you put down here. We'll go over that in just a moment. But over here, this is where you will ask if they have other health insurance, and you need to ask them that because you need to complete that, either yes or no. In this situation, she did because she was paying health insurance. Is this individual or this household a tax filer household or a non-tax filer household? They were a tax filer household because they were filing taxes jointly and claiming all the children, so this is considered a tax filer household. So on line 1 should always be your applicant. The person that you list up here as the applicant should always be on line 1. You're going to put their date of birth, gender, race, relation to applicant, and if it's the applicant, it's already pre-populated as self, but you will fill out the relation for everybody else. Then this is where you're going to fill out the income. You're going to have your type, and here are the letters that you can use for the type of income that they have. So if they're working, you can use W. If there's other letters up here that you want to use, you can. Like for instance, if they're employed, you can use E, and that stands for employment. But I would use the ones that are listed up here. Then the amount, you're going to put the amount in this field. Remember, she was working 40 hours a week, paid $34 an hour. Do not put the hourly amount in this field. Again, do not use the hourly amount, because if you put the hourly amount, then I don't have, or you cannot indicate how many hours that they work. So you're going to have to go ahead and calculate and multiply the number of hours times the hourly rate in order to get the amount to put in this field. So in her case, she was working 40 hours a week at a rate of $34 an hour. Once we multiply that, we got $13.60. So that's the amount that I put in this field. How often was she paid? She's paid every week. So that tells us that this frequency part will tell us what we need to do with this amount. Do we need to convert it, or is it already in a monthly amount? So if we need to convert it, then you take that $13.60 and multiply by 4.3333, and that gave us $5,893.28. Make that a little bit bigger. Too big. Okay, $5,893.28. And remember, she had that health insurance and the dental insurance. So once we converted each one of those separately, you can add them up. And once you add them up, you can put the total amount here. And that's how we got the $194.99, because once we converted the dental insurance and then converted the health insurance to a monthly amount, then we added those two monthly amount totals to get this right here, the $194.99. She did not have any 1040 deductions, so that field can be left blank. So now what we're going to do is to take our pre-tax deduction and subtract it from our monthly amounts, and that gave us $5,698.29. Okay. Of course, you're going to have to ask about if they're a U.S. citizen or a lawful present immigrant. Remember, ask if they're a U.S. citizen first. If yes, then check yes. If they're not, then you're going to ask them when you enter the United States, and then you're going to use your immigration policy to determine if they are considered a qualified immigrant or a lawfully present immigrant or not. And then the other lines are going to be the other household members or the other people in the budget group that should be listed. So the next person I put was her spouse, along with his date of birth, gender, race, relation, and then their child that they had, his date of birth, gender, race, and relation. And if the spouse had any income, I will complete the income field for him as well on his line, just like I did for Mercedes. Okay, go down to your subtotal net income. Remember, I told you everything that's in this last column, that's the amount that's going to come down here to your subtotal net. So your subtotal net is still the same, $5,698.29. Num in the budget group is 5 because you have her husband, her child, and then the 2 unborn fetuses down here. So that's a budget group of 5. The income limit for a budget group of 5 is $5,691. If you compare that to this subtotal net, you see that they are over. So you need to use the 5% deduction, which was $130 for a budget group of 5. Now you're ready to subtract that $130 from the $5,698.29, and that would give you $5,568.29. And now you see that compare the total to the poverty income level, they see that she's now eligible. So you're going to check the box where it says eligible, number of weeks she's pregnant, how many she's expecting, and what the delivery date, the estimated delivery date is. This box should always be checked because they should always be completing the 94A, so this should always be checked. And then you're going to put all of your information down here at the bottom. So the date, print your name, your title, your phone number. You're going to do your signature, and you can use an electronic signature on here. Remember the name of your facility or health department along with the address, and then the qualifying provider ID number. Over here, you need to read, you can read this out to your applicant, or either you can give it to them to read it if they're in the office with you, and then they need to sign it and date it. But in this case, this member called, so we're just going to read this sworn statement out to her. And these 2 fields are going to be left blank because we're going to do the attachment A to signify the signature. So that is all to the PE application. The next one is the attachment A. So since we're doing this over the phone, remember you need to read these statements to your applicant. Ask this question, do you understand and agree to these statements? They say yes, you're going to check yes. Then you're going to print their name, date it, print your name, and sign it. And you're going to send it as part of your PE packet, so this serves as the signature. So that is example 1 of an application being done over the phone. So now let's go to our next example. We have Sand Ham, 19. She's pregnant with 1 child, lives with her mother, Tan Ham, who's 51. Sand's boyfriend, Pike, who's 20, also lives in the home. Sand is unemployed, but her mother works and earns $1,200 every 2 weeks. Sand's boyfriend also works and earns $450 every 2 weeks. There is no pre-tax or 1040 deduction. Tan will file taxes and claim Sand as a tax dependent. So that means Sand, she's the applicant and she's being claimed as a tax dependent. So that means she needs to follow, you need to see if she meets one of those exceptions. Sand states that no one has any other health insurance. Sand is applying for PE. So let's look at our steps. You're going to screen Sand in Gammas to see what comes up. Once we screen her, it gave us her ID number, and it shows that she's active, and she's active on P4HB 181. So that tells us that we're going to not only do the PE process, we're going to also have to complete a PE manual update form. You're going to complete the 632 and all other required forms. So this is the application where you're doing the interview and the person is in the office with you. You're going to determine if that individual will be eligible or ineligible. If so, you approve the PE, enter it into Gammas. Right here it says complete the PE manual update form, and you're going to send the form along with the 632 to the PE correction box. And this time you don't have to send the attachment A because this was not an application done over the phone. Give the applicant the 634, which is the approval notice, the temporary certificate, which you will print out from Gammas, the understanding booklet, the quick guide, the notice of ADA, and the P4HB information. Inform the applicant of the PE period time and that their full application will be sent to DFAX for processing, and you will send the PE packet to DFAX within 5 business days. So let's go back to it. It says there is no pre-tax of 1040. Tan, which is her mother, will file taxes and claim San as a tax dependent. Well, let's go back to our budget group flow chart so you can look at that. And this person is an individual that is claimed as a tax dependent. So she's claimed as a tax dependent. Sam is the one applying. She's claimed as a tax dependent. So we have to see if she meets one of these exceptions. The first is expected to be claimed by a tax dependent by someone other than a parent or a spouse. That's not true to her because she's being claimed by her parents, so that doesn't apply to her. Under the age of 19, who lives with both parents and expects to be claimed by one parent, but the parents, married or unmarried, do not expect to file taxes. That doesn't apply to her because you look at her age, she's age 19. Child under the age of 19, that doesn't apply to her either. So neither one of these exceptions apply to her. So that means we're going to follow the error that says no, and we're going to apply tax filer rules. So in her household should be the tax filer, everyone that tax filer is claiming, the tax filer spouse if living together, and then the unborn fetus. So let's go back to our example. Sorry. It says Tan will file taxes and claim San as a tax dependent. Even though her boyfriend is staying there, Tan is only claiming San. So that means it should only be Tan and San in the budget group. The boyfriend is not included. And the unborn child. So it should be a budget group of 3. What is the income? Tan is the one that is working. She's working and earns $1,200 every 2 weeks. We do not include the boyfriend's income because he is not a part of the budget group. So we're only going to include the income of the people that are in the budget group. So in this situation, it's only Tan's income, and she's paid $1,200 every 2 weeks. So we need to convert 1,200 times 2.1666, and that gave us $2,599.92, and that is the income. There are no other deductions that we need to subtract. She didn't have any pre-tax deduction or 1040 deductions. Again, this is the information that you use just to complete the PE application. And so we're just going to input this information onto the application. Make it bigger so you all can see. Okay, so the application date was 3/22/21. It gave us her ID number because she's active on P4HB, so you can put that information up here. San is the one that is applying, so we're going to put her name, her address, along with the city, state, zip code, and county of residence, and the telephone number. Remember, the Social Security number is optional. Nobody else had health insurance, so you're going to darken in or check the box for no. Tax filer household or non-tax filer household. This is a tax filer household because we just went through the budget group flow chart. And now we're ready to input the information. So remember, whoever is up here is the person that should be on line 1. So we're going to put San Ham information on this line, along with her date of birth, gender, race, and relations are already pre-populated to self. She does not have any income, so we can leave that, the rest of these fields blank. Then number 2, you're going to ask her about her citizenship, immigration status, and she is a U.S. citizen. Then you're going to enter her mom's information, the name, date of birth, gender, race, relation, she's the mother. Income, she is working, so we're going to use W for the type. What is the amount? It's $1,200, and she is paid every 2 weeks, so it's bi-weekly, B or BW for bi-weekly. And I meant to tell you that for the frequency, you can use like WK for weekly, BW for bi-weekly, S or SM for semi-monthly, M or MO for monthly, and of course, A or Y for yearly or annually. And then that means that we need to use our conversion factors, and when we converted this $1,200, it converted over to $2,599.92, and that's because we multiplied 1,200 times 2.1666. Your monthly income came out to be $2,599.92. And that is everybody on that application. So you come down to your subtotal net income is still $2,599.92 because that's the only income in that last column. Budget group of 3 because it's her mother, and then the one child she is expecting. The income limit for a budget group of 3 is $4,026. If you compare that to the income limit, you can see that she's under that. So we do not need to use the 5% deduction. So your total net income is still the $2,599.92. Darken in or check the box that she is eligible, 20 weeks pregnant with one child, and what the due date is. Remember to always check this box for yes that an application was obtained and signed. Your information goes down here. You will read this sworn statement to your applicant or let them read it, and then they will need to date and sign it. So this is the application done in the office with you. Okay. Oh, one more thing. Remember she had Planning for Healthy Babies, the P4HB 181. So that means we need to complete a PE manual update form. The date is the same date as the application. I check the box for pregnant women. Go down to where it says terminate P4HB, check that box. And then I go down and put my name and my telephone number, and then I'm going to email this form along with a copy of this 632 and send it to the PE corrections email address that is listed up here. And that's it. Okay. So for the online procedures, remember you're doing everything on paper first. Once you have determined that that individual is eligible, then you're going to be inputting that information into GAMIS. If the individual is eligible and you enter the information into GAMIS, like I said, you will be able to print out a temporary certificate to give to them, and you're going to need to make sure you give them a copy of this certificate because it will have the RX bin number on there for pharmacy. So it will have the pharmacy bin number on there that the pharmacy would need in order to, you know, fill their prescriptions. And then also giving them a copy of the 634, and then within 5 business days, send your PE packet to DFACS. Okay, now we're going to look at the screenshot. So I've done everything on paper. Now I'm ready to add this PE to GAMIS, okay? But the first thing I want to show you is the screening part. Before you start a PE application, remember you must screen each individual person. So once you go into GAMIS and you log in, you're going to hit eligibility. And these are the fields down here that you can search someone by. If they already have the ID number, you could put in their ID number. If they don't, you need to put in their name, their first and last name, date of birth, and social security number. And then you need to make sure you put a from and through date of service, a date of service. Once you put all that information in, you're going to click search. And then in the middle of the page, if the member was ever on Medicaid, the last information that we have from them, if they're not currently active, will populate down here. And so if they don't have their ID number, this is where you will get their ID number. And then you will look at this information because this will let you know if this is something that you would need to update. So if it is, if you see like her address or something, or name is not correct, once you're going through the process, you know you need to update that. If not, after you hit submit, you're going to have to complete a PE manual update form. And then down here, it will let you know what their eligibility is. So if they're inactive, it'll show inactive up under status. If they're active, it will show active. And then over here where it says aid category, make it a little bit bigger, where it says aid category, you would need to see what aid category they're active up under, because depending on the aid category they're active up under, there are certain procedures that you would need to follow. So once you've done that screening part, then you would determine, if they are eligible to apply for PE. If they are, you would do your PE application and all of your other required forms to make a determination. If they are eligible, then this is where you need to go to input them into GAMIS. So you're going to go back to the home page when you're signing in, and you're going to click on Presumptive Activations. Then you're going to select Pregnant Women Activations. So you're always going to select the Pregnant Women Activations. Once you select the Pregnant Women Activations, it will ask you to enter in the member's ID number. So that's the way why you're screening them, is to get their ID number if it was known. You're going to enter the information in, the ID number for the member. If the member never had Medicaid in Georgia, then they don't have an ID number, so you don't have to put anything in there. You just start filling this information out. So if they have an ID number, you'll put it in here and hit enter. Once you hit enter, then it's going to pre-populate the information that we last had for them. So this is where you would go in and start updating the information that you would need to update. Of course, you're going to put the income, and that is coming from your 632. If the name needs to be updated, looks like you can update the last name, but you cannot update the first name, you can't update the date of birth, and you cannot update the social security number. So those are, if those fields need to be updated, you're going to have to do P manual update form. So you're just going to fill out the information, and this is all coming from your 632. Then you come down here, it says Medicaid application submitted. This should always be a yes. Remember, because this is about the 632, so the 632 should always be completed. It's going to ask you what the application date is, and that should be that date. The same date that you're approving them is the same date that you need to put it into GAMIS. So you cannot approve somebody one day and then thinking you can come back and add them the next day, because if that happens, the presumptive eligibility is not going to actually start on the date that you took the application. It's actually going to start on the date that you put it into GAMIS. So it's very important that you're going to do this on the same date. And then in order for that day to pick up, is they will have to be approved for full Medicaid, and full Medicaid will go back to the first of the month in order to pick up that date. So it's very important that you are doing this all in the same date. Then you're going to put what her due date is and then the number she's expecting. Before you hit submit, please make sure you verify this information first. And that's what this is telling you, to verify this information. Once you verify it, you're going to hit submit. After you hit submit, then it's going to let you know the request was successfully processed. If they did not have an ID number already, then GAMIS will issue them an ID number, which will be listed right here. And then the temporary certificate that you need to print out for them, you're going to click on this hyperlink where it says Certificate of Eligibility. Click on that. Another window will pop open in PDF, and you will be able to print out that temporary certificate. So those are all of the steps that you need in order to add the PE to GAMIS, and also the steps that you would take in order to screen someone first to determine if they will be eligible to apply for PE. Okay, now for your references, this is the website to the GAMIS web portal. This is where you would go and enter in the PE. This is where you would go to screen your applicants. This is where you would go to locate the policy manual. And this is also where you would go to get any forms that you need to print out. And it tells you right here. The Form 94A, you can either continue to print off of the ones that I gave you, or either you would need to order those through DFAX. If you don't already know how to order these through DFAX, please send me an email and I can let you know who you would need to reach out to in order to get these ordered. And then I told you earlier how to order the Understanding Medical Assistance booklet. Okay, if for some reason you're having issues with billing or claims, anything of that nature that is outside of really policy, because I'm just the administrator over the policy part of the program, but if you're having issues dealing with billing or claims, then you need to reach out to the Gainwell Technologies Provider Contact Center. And you can either call the 1-800 number or either go online and submit a web portal contact. And once you submit that, someone will reach back out to you. So if you have any type of billing or claimant issues, please make sure you're reaching out to the Provider Contact Center for Gainwell Technologies. So for my new people, if you are a veteran worker and you are viewing this training, this is just a refresher training for you. There's nothing else that you need to do. So if you want to go ahead and log off, you can go ahead and log off, because there's nothing else that you need to do, because this is just a refresher for you. So the next few slides is just for people that are new, that are brand new, and they're coming into this training for the first time. So if you're coming into this training for the first time, after you have reviewed or viewed this training, there is an assessment that you would need to take. And remember, you have to take this assessment and pass with the 80% or higher before you're able to start making PE determinations. So here are the instructions in order to get your assessment. If you do not follow these instructions, then you will not get your assessment. So in order to get your assessment, you need to make sure that you send me an email letting me know that you have reviewed this training. Once you send me an email stating that, I will reply back to you with the assessment. And once you get your assessment, you can go ahead and complete it. So that is the instructions of how you get your assessment. Because I always get questions after the training. Well, Kenita, I didn't get my assessment. How do I get my assessment? This is how you get your assessment. Send me an email stating that you have completed reviewing this training and that you need your assessment. And I will reply back to you with the assessment. Once you have been given your assessment, then you need to complete your assessment. You also need to complete a sign-in sheet. And that will all be in the email with your training material, because you will receive a training. You should receive a email with a listing of all the training material. That's all the forms that we went over through this, the PowerPoint, the sign-in sheet, and also the statement of completion form. So you will need to do a sign-in sheet. You will also need to read, initial, and sign the statement of completion form. And then also on that form, when you're signing it, you will also need to make sure your initial beside each training materials that you did receive. So if you received it, I need to see initials beside it. So you will sign it off on it, and then you will also need to get either your PE coordinator or your immediate supervisor to sign as well. And then I need to put up here, sign, complete sign-in sheet. Sorry about that. So you do your statement of completion, you complete the PE assessment, and then you also sign the sign-in sheet. Once you have all of this completed, do not send me the assessment by itself. Do not send me the sign-in sheet by itself. Do not send me the statement of completion form by itself. Wait till you have everything completed. You have the assessment completed, you have your sign-in sheet completed, and you have your statement of completion completed with all required signature. Once you have all three pieces of information completed, you need to return that back to your PE coordinator, and your PE coordinator will send that information to me. Again, To get your assessment, send me an email that you have completed reviewing this training and that you need your assessment. Once you have that, you need to get your statement of completion form completed by yourself and your supervisor. Complete your assessment, complete the sign-in sheet, and return everything back to your PE coordinator so they can turn it in. Here is my contact information. This is for your reference only. Please do not give out my contact information to anybody unless you reach out to me first. Let me know what the situation is, and then I will let you know, if you're able to go ahead and give out my contact information. But this is for your use only, for you to contact me. So if you need to contact me about anything, please try to use my email address as your first point of contact. And that's because I'm in, so many different meetings every day, and it's hard for me to answer the phone, so I can better respond to email. So try to email me first. Then if you can't get me by email, then of course you can try me by phone. So this concludes the training for presumptive eligibility for pregnant women. I hope you enjoyed the training, and I hope you got everything that you needed. As long as you follow everything that you have been provided here today, you should be able to make PE determinations correctly in accordance to DCH policies and procedures. And like I said, if you have any questions while you review this training, please make sure you have wrote down those questions. So when you are sending back your information, you can also send back your questions. So that is another piece of information when you're sending back for new employees. If you're sending back your sign-in sheet, your statement of completion form, and your assessment, also send back in your questions, and I will get those responses back out to you. And like I said earlier, I will try to compile all the questions and answers together into a FAQ and send it out to everybody. Well, I thank you for taking the time out to view this training. Hope you enjoyed everything. And like I said, if you need anything or need any help or have any more questions, you can please feel free to reach out to myself. So again, thank you for attending this training, and I hope you have a great rest of your day. Thank you.